Hello class, my name is Erica Tedian, and today I am going to be presenting to you on the topic of squamous cell carcinoma. What is squamous cell carcinoma? SCC, as it is known, is a tumor of the epidermis that is usually painless, and it's usually found on exposed areas of the skin. SCC occurs when there is damage to the DNA of the skin from exposure to ultraviolet radiation or other agents that cause changes to the squamous cells. There are usually two types of squamous cell carcinoma. One is in situ, which is known as Bowen's disease, and invasive, which is when it has invaded other tissues or organs. While mostly found on the face and neck, SCC can also occur in the oral cavity, the pharynx, the oropharynx, and the tonsils. And one thing I learned from this presentation is that HPV viruses are usually where SCC will be found in the oropharynx. How widespread is SCC? Well, believe it or not, in the United States, over 1 million cases are being diagnosed per year, and that equates to 115 cases being diagnosed per hour. The incidence of the SCC has increased 200% in the past 30 years, and if I had to make any guesses as to why that would be, I would guess it would be due to indoor tanning bed use, although I didn't find anything about that. Almost 8,000 deaths related to SCC in the U.S. are reported annually. There are quite a few risk factors that predisposes one for getting squamous cell carcinoma. Some of those are UV radiation, specifically indoor tanning bed use. The immunocompromised are going to be at increased risk for getting SCC. There is a genetic predisposition to developing this type of cancer. And if you have a history of skin cancer, more than likely your chances for getting SCC will occur. Anyone over the age of 50 and anyone that has fair skin is also at risk. Believe it or not, men are more prone to developing SCC than women. In fact, my dad has it. I also found from the research that a history of HPV has recently been shown to give you increased chances of having SCC. Some additional factors on the photo that I posted is those that have blue or green eyes, red or blonde hair, and a history of sunburn and prolonged sun exposure is also an important factor to consider. How is squamous cell carcinoma diagnosed? Well, people will go see their provider, and the provider will perform a thorough skin assessment and will take a thorough H&P. Questions regarding the history of the patient having any severe sunburns, being outside a lot, indoor tanning use, and genetics will be asked by the provider. The provider will then do a thorough skin assessment, and he will be looking for lesions that have what are known as A, B, C, D, E characteristics. If you look at the photo, you will see those stand for asymmetry. Anything asymmetrical is a telltale sign that there might be something else going on. They're going to look at the borders. If they're even, it's usually benign. When they're uneven, there is concern. The provider will look at the color. Things that are one color, usually not a problem, but when there's multiple colors involved, it usually indicates it might be SCC. They're going to look at the diameter of the skin lesion, and anything larger than 1/4 of an inch is suspect of a problem. And also they'll be asking the patient if these growths that they've seen have been evolving or changing over time. If they've been increasing in size, shape, or the color, they're going to be suspect that there's something problematic occurring. The provider is also going to look at the lymph nodes during this assessment to rule out any metastasis. How SCC is treated. Treatment for early stages of SCC includes surgical excision or radiotherapy. If the cancer is diagnosed in more advanced stages, it's going to require surgery in addition to radiation or chemoradiation. And finally, if metastasis is involved, it's going to also the patient's going to require to have some chemotherapy as well. There are some national screening and treatment guidelines in regards to skin cancer. The United States Preventive Services Task Force has two guidelines in regards to skin cancer. The first one is in regard to just screening for skin cancer in all individuals. Per the task force, they feel that there is insufficient evidence to screen for skin cancer in all asymptomatic individuals. However, they also talk about behavioral counseling for skin cancer. And for this particular topic, the task force does recommend counseling for all children, adolescents, young adults, and parents of young children in regards to educating ways to decrease skin cancer risk. Sorry. What can be done to prevent squamous cell carcinoma? First of all, examine your skin once a month from head to toe. If you happen to see any unusual spots, it's really important that you follow up with your physician. For those that are more predisposed to skin cancer problems, or maybe if you have a history of it in your family, it's suggested to go see a dermatologist annually and allow them to do a professional skin exam on you. The CDC also recommends to protect your skin from the sun, performing sun safety. Some of those interventions include using sunscreen, making sure that you're really staying covered when you're in the sun by wearing appropriate hats, long sleeves, sunglasses, and if possible, seek the shade when you are able. In conclusion, squamous cell carcinoma is really not something to be taken lightly. If you think about it, the skin's the largest organ in your body, and it's really important that we take care of it, not just now as we're getting older, but even when we're younger. I know society really continues to promote tan skin is in, but it's not healthy. And to help educate our future patients about the importance of really using sun safety precautions will help in the years ahead. Thank you.